Most people assume that the dark circles under their eyes are a dead giveaway, that they aren't getting sufficient rest. But here's the reality. You can clock in a solid 8 hours of sleep every single night and still wake up staring back at a reflection that looks utterly drained and exhausted. Why? Because those persistent shadows can stem from a whole host of underlying factors, ranging from seasonal allergies and thinning skin to a loss of collagen, inadequate hydration, pigmentation irregularities, dietary shortcomings, hereditary traits, or even the natural bony structure of your face. And here's the critical part. Unless you take the time to accurately identify which specific type of dark circle you're dealing with, you could very well be applying treatments that are entirely misaligned with the real root of the problem. Now, for the vast majority of cases, dark circles are completely harmless and nothing to lose sleep over. However, the way they present themselves, their specific pattern and behavior, can sometimes offer you surprisingly useful clues about exactly what is making them so much more prominent and noticeable. Consider the anatomy of the area for a moment. The skin that sits directly beneath your eyes is among the thinnest, most fragile, and most delicate skin on your entire body. And right underneath that paper-thin surface lies a complex network of tiny blood vessels, connective tissue, and a layer of fat. So anytime something causes that skin to become even thinner, or makes those underlying vessels more conspicuous, or increases pigmentation in that region, or causes the supporting tissue to sink and become more hollow, it will inevitably create that dark, shadowy appearance that we all recognize. And without a doubt, one of the most frequent culprits behind this transformation is the natural process of aging. Yes, it's true. When we are young and vibrant, collagen is the structural backbone that provides the skin with its strength, thickness, and overall support, while the fat pads beneath the eyes help maintain a smooth, even, and youthful surface contour. But as the years inevitably march on, our body's collagen production begins to taper off significantly, which causes the skin to become thinner and less resilient. At the same time, that supportive volume gradually diminishes and shifts, leading to a loss of plumpness. This combination of factors allows the bluish, purplish, or reddish hue of the underlying blood vessels to show through much more easily than it ever did before. Simultaneously, the hollow area just below the lower eyelid, what professionals often refer to as the tear trough, can become noticeably deeper and more pronounced, which causes light to hit the face in a way that casts a shadow over the area. This is a crucial distinction to grasp, because what visually appears to be dark pigmentation on the surface might actually be nothing more than a structural shadow created by the contours of your face. And that distinction matters enormously because simply drinking more water or slathering on a brightening cream will not effectively correct a deep structural hollow. Those interventions simply cannot reach the underlying architecture that is causing the shadow. Beyond the passage of time, genetics is another overwhelmingly powerful factor at play here. Some people are simply born with a natural predisposition to thinner under-eye skin, deeper tear troughs, more prominent blood vessels, or an increased concentration of pigmentation in that particular area. These individuals may notice their dark circles making an appearance very early in life, often during childhood or adolescence, and they will frequently observe the same trait in other members of their family tree. When genetics and the underlying facial skeleton are the primary driving forces behind the issue, those dark circles may not be entirely erasable. They may be a permanent feature of your facial landscape. However, that doesn't mean you're powerless. By diligently protecting the skin from harmful irritants and environmental stressors, and by adopting a gentle, consistent skincare routine, you can often prevent them from becoming even more pronounced and noticeable over time. Now, let's talk about sleep. Undoubtedly, sleep plays a monumental role in the appearance of your under-eye area, but the relationship is far more nuanced than simply counting the hours you spend horizontal. The issue is that poor quality sleep can cause your overall complexion to appear paler and more washed out, which in turn increases the stark contrast between your skin tone and the darkness lurking beneath your eyes. Furthermore, a lack of restorative rest can contribute to fluid retention and puffiness, which actually creates more pronounced shadows by casting deeper indentations. The real problem often isn't the number of hours you spend in bed, but rather the quality of the sleep you're getting. Issues like fragmented sleep, chronic stress, frequent awakenings throughout the night, loud snoring, or undiagnosed sleep apnea can wreak havoc on your rest. You might be physically in bed for 8 hours, but your body and brain may not be receiving 8 hours of truly restorative, healing sleep. To combat this, do your best to maintain a consistent sleep schedule, reduce exposure to bright screens and stimulating content in the hours leading up to bedtime, and most importantly, have a conversation with a qualified healthcare professional if you consistently wake up feeling exhausted or if you experience disruptive symptoms like loud snoring or gasping for air during the night. Another incredibly common, yet frequently overlooked trigger is allergies and nasal congestion. This is one of those connections that many people simply never make with the appearance of their eyes. Allergies can significantly slow down the normal flow of blood through the small veins that reside beneath the eyes, leading to a bluish or purplish discoloration that is often colloquially referred to as allergic shiners. On top of that, allergies frequently make the eyes intensely itchy and watery, which incites a reflexive urge to rub them. And because the skin surrounding the eyes is so exceptionally delicate, chronic rubbing can severely irritate those fragile tissues, escalating inflammation and gradually causing the skin to become darker and more discolored over time. If you notice that your dark circles become significantly worse during specific seasons of the year, or if they appear alongside symptoms like sneezing, nasal congestion, itching, or watery eyes, then allergies are very likely playing a substantial role in your situation. The most effective approach is to collaborate with your healthcare professional to develop a strategy to control those underlying allergies at their source, rather than simply rubbing the symptomatic area and making matters worse. In the meantime, applying cool compresses over your closed eyes for several minutes can work wonders by reducing swelling and constricting those dilated blood vessels. However, a word of caution: never place ice directly onto the delicate skin of the under eye area, as this can cause ice burns and further damage. Sun exposure is another major and often underestimated contributor to the darkening of the under eye region. The sun's ultraviolet rays actively stimulate the production of melanin, which is the pigment responsible for skin color, and over time, this constant assault of UV radiation can darken the under eye area and make any uneven pigmentation much more pronounced and stubborn. That is why it is absolutely imperative to apply a broad-spectrum sunscreen with an SPF of at least 30 every single day, regardless of the weather. When choosing a sunscreen, opt for a gentle facial formula that is specifically designed not to irritate the sensitive eye area. Additionally, make it a habit to wear UV-protected sunglasses whenever you are outdoors. High-quality sunglasses serve a dual purpose. They protect not only your eyes from harmful rays, but also the delicate skin that surrounds them. They also reduce the need to squint, which over time can create repeated folds and stresses in the tissues, contributing to wrinkles and shadows. Dehydration is yet another factor that can make dark circles appear dramatically worse. While it's rarely the sole cause, when your body is dehydrated, your skin tends to look noticeably duller, less plump, and more sunken in, which makes any underlying blood vessels and shadows far more conspicuous. To keep your skin looking its best, make sure you are drinking enough fluids throughout the day. A good general guideline is to keep your urine a pale yellow color, but always remember that your specific hydration needs can change based on factors like physical exercise, hot weather, certain medications, and any underlying medical conditions you may have. It's also worth noting that excessive alcohol consumption can be a double whammy, as it dehydrates you and simultaneously disrupts your sleep quality, both of which contribute to a more tired and haggard appearance around your eyes. So, while proper hydration won't erase genetic pigmentation or magically replace lost collagen, it can certainly help your skin look healthier, more vibrant, and less drawn. Your overall nutrition and general health may also play a role for some individuals. It is crucial to understand that dark circles on their own do not automatically prove that you are suffering from an iron deficiency, a vitamin B12 deficiency, or any other nutritional shortfall. Therefore, you should absolutely not start taking high doses of iron or other supplements simply because the skin beneath your eyes looks darker. That would be an unwise and potentially dangerous decision. However, if you notice that new or progressively worsening dark circles are appearing alongside other concerning symptoms like unusual fatigue, generalized weakness, shortness of breath, or unusually pale skin, then it is definitely time to have a conversation with your healthcare professional. A simple medical evaluation or an appropriate blood test can reliably determine whether you are anemic or if some other underlying condition is contributing to your symptoms. The safest and most prudent approach is always to identify a confirmed deficiency before attempting to correct it with supplements. So, with all of these factors in mind, what practical steps can you actually start taking today? Begin by carefully studying the specific pattern and behavior of your own dark circles. Ask yourself some key questions. If the discoloration has been present since you were a child and it clearly runs in your family, then genetics and facial structure are probably the main contributing factors. If the darkness tends to flare up in sync with allergy seasons and is accompanied by itchy or watery eyes, then congestion and rubbing are likely involved. If the shadows become more obvious and pronounced after a night of poor sleep, a bout of drinking, or a day of inadequate hydration, then your daily habits are probably intensifying the issue. If the skin itself appears to have a brownish hue, then pigmentation is probably a large part of the equation. If it looks more blue or purple, then visible blood vessels are likely contributing. And if the darkness seems to change depending on the lighting or the angle of your face, then it may be more of a shadow caused by a deeper tear trough. Once you have a better understanding of your personal situation, you can take proactive steps. Protect the delicate under eye area from the sun on a daily basis. Avoid rubbing or pulling at the skin, as this can cause irritation and damage. Treat your allergies appropriately with the help of a medical professional. Work on improving the consistency and overall quality of your sleep. Stay adequately hydrated throughout the day. And when it comes to skincare, opt for gentle, soothing products rather than harsh scrubs or strong active ingredients that can cause more irritation. A simple, fragrance-free moisturizer can work wonders to support the skin's natural barrier and make the tissues appear much smoother and more plump. Some products that contain beneficial ingredients like vitamin C, caffeine, niacinamide, peptides, or carefully formulated retinoids may help with certain types of discoloration or age-related changes. However, always remember that the eye area is exceptionally sensitive, and stronger does not necessarily mean better. In fact, stronger formulations can often backfire and cause more harm than good. Introduce one new product at a time, keep it carefully out of the eye itself, and discontinue use immediately if you develop any significant redness, burning, itching, or swelling. For those persistent circles that are caused by deep tear troughs, prominent blood vessels, or inherited pigmentation that doesn't respond to over-the-counter options, these issues may require a professional evaluation by a board-certified dermatologist or another qualified specialist. This is because effective treatment must be meticulously matched to the actual cause. The cause is paramount. You have to find out exactly where the problem is originating from in order to address it properly. And here is one final, incredibly important warning. Ordinary dark circles typically appear beneath both eyes more or less symmetrically. If you develop a new change beneath only one eye, especially if that change continues to progressively worsen, or if you experience any accompanying symptoms like pain, significant swelling, redness, changes in your vision, or if you've recently suffered trauma to the area, you must have it professionally evaluated rather than dismissing it as merely a cosmetic concern. Do not assume it's just another dark circle. Get it checked out. Your dark circles, in and of themselves, are not a definitive diagnosis, but they can certainly provide you with valuable clues about what is happening inside your body and with your lifestyle. Take a close look at when they first started, whether they appear in other family members, whether they worsen with allergies or poor sleep, and whether the darkness comes from pigment, visible blood vessels, or simply a structural shadow. And once you take the time to truly understand the underlying cause, you can then stop simply covering them up with concealer and start addressing what is actually happening beneath the surface of the skin. Please take a moment to share this valuable information with someone who always looks tired, even after what they claim was a full night's sleep. I sincerely hope this video provides you with helpful insights and actionable advice. Feel free to leave your comments and questions below, and most importantly, make it a great day. I'm Dr. Alan Mandell,